So we are increasingly recognizing that adults with sickle cell disease have infertility risks. Some of those risks are attributable to the disease itself. So we always say that survival is the precondition for reproduction. So, this is a happy outcome. People with sickle cell disease are living longer. And we know that the disease itself can cause social impairments. So just meeting people, having a date, but also pain, hospitalizations. Those are risk factors for infertility. Other risk factors for infertility include all of the risk factors in the general population. And then sickle cell disease is a disease of accelerated aging. And what we see what we're seeing in the data and what we see in the patient population is that menopause onset is sooner and menstruation onset is later. And so that gives you a narrower reproductive window. One of the open questions about infertility risks in sickle cell disease is which treatments might affect fertility either positively or negatively. Certainly we see that curative therapies, the preparative regimens for curative therapies are clear infertility risks. I always talk to my patients. We need to be talking particularly to adults with sickle cell disease about their family building plans. Once you know their family building plans, you can start to address how you'll know whether they have infertility. Infertility isn't a laboratory diagnosis, it's a clinical diagnosis. So you have to try to conceive for 6 months if you're older than 35 or for 12 months if you're younger than 35. I use those thresholds softly in sickle cell disease because we don't know if those age cutoffs are actually appropriate, but that's a clinical diagnosis. So in my patients who tell me that they're trying to get pregnant, which are patients who are, it's possible to collaborate with, we can tell them, well, we'll know that we have a concern for infertility if you don't conceive in 6 or 12 months.